I've seen a lot of caesarean scars, and I just thought I'd talk you through the scars because they're particularly interesting in this patient. So initially, what we have normally over a caesarean scar is because the scar is tethered, the skin overhangs, and we sometimes have excess skin in the flanks. In tummy tuck, what we do is remove all the tissue under my hand there. Now let's have a look at those scars. Can you see there are three separate scars at least there? That's the scar on the left. I'm just going to trace it over to the right. That's the first scar, that long. And this is the second scar, which you can see is more to the right than the first scar. And then there's a further scar there. And all of these scars are adherent to the underlying muscles, and that's why you get the overhang over the areas there. What is interesting though is that these scars are all separate. So a plastic surgeon, if they were doing a caesarean, would remove the old scar and then sew up fresh tissue, so then you're only left with one scar. Obstetricians often, when they're having or delivering babies, it's much more pressure on getting the baby out, and that's the focus, so they don't tend to focus so much on the scars. And what's interesting though is a lot of the scars are higher on the left side where my finger is, and then they go slightly more downwards towards the right side. And also many of the scars are centred over to the right, so they're not completely in the centre of the tummy. In some countries, such as South America, the scars are much lower because the trend with the swimming costumes and underwear is much more revealing, so the scars are much lower. But in the UK, this is the average position for a caesarean scar. And normally, because you are tilted, the patient is tilted during a caesarean scar, often the scar is more over to the right side. So you can see the scar's healed well, but isn't centred adequately. And in a tummy tuck, what we would do is we would remove all of the scar tissue. So our initial incision would be below the scar, so all of the scar would be removed. So we can see here, I'm just pointing here towards either side of the scar. This is the scar where it starts on the left, and you can see that the right side is further over. And really got quite a long scar there because of the three scars all in different areas. Scars healed very well actually in this case, where it should normally heal in a flat pale line, but the scar over at the right side, if you can see, is slightly redder and more inflamed. And so those stretch marks between my fingers will all go, and the aim after the surgery is to remove the tissue from the tummy button and down to the scars, remove all of that area, and then this tissue here is then sewn down to there. So in this patient, you should get a really good reduction in her stretch marks, in these stretch marks on her anterior tummy, because that's the tissue that will be removed.